You know how we're always talking at the link between our overall health and what's going on in our mouths? Well, get ready to dive into a huge E part of that, because we're tackling oral health and disabilities today. And let me tell you, the stuff you dug up is eye-opening. Like, seriously, some startling stuff in these excerpts. But before we get into the nitty-gritty, let's talk numbers for a sec. It's crazy, but did you know that 1 in 4 adults in the U.S. are living with a disability?
It's a staggering statistic when you think about it. That's 61 million people.
61 million. See, that's what I mean. This is huge.
It really highlights the importance of having this conversation. And to
Mhm.
really grasp the scope, we need to be clear about what we mean by disability, because it's a really broad term. It covers any condition, whether it's physical or mental, that makes everyday activities harder.
So we're talking mobility issues, chronic illnesses, sensory stuff, the whole gamut.
Exactly. It's a massive range of experiences, and they all impact a person's life in a big way.
And that's what's so important, right? It's not just one condition, one experience. It's all these different disabilities and how they connect to something as basic as taking care of our teeth and gums.
Mhm.
And the research you sent, it was clear. People with disabilities are way more likely to have problems with their oral health. Why is that? What's the connection?
Well, it's a whole bunch of things coming together, but access is a huge one. Plus, different disabilities come with unique challenges. Just imagine something as simple as brushing your teeth, right? Now imagine you have limited mobility in your hands or arms. Suddenly, what seems simple becomes a daily challenge.
It makes you realize how much we take for granted.
Totally. And that's just one example. Then you think about the obstacles someone might face just getting to the dentist regularly, transportation, cost, all of it.
It's about realizing that even basic oral care can become a major hurdle depending on your situation.
Exactly. And on top of that, you've got medications.
Hmm.
A lot of medications used for conditions related to disabilities, they have this side effect that might seem minor at first. Dry mouth?
Yeah, dry mouth, kind of annoying, but no big deal, right?
Not so fast.
Mhm.
A lot of people don't realize that dry mouth is a big deal because it increases the risk of cavities and gum disease over time, like significantly.
Wait, really?
Oh yeah. It's like this sneaky consequence of these medications that can turn into some major oral health issues down the line. It just goes to show how crucial it is to pay attention to the full picture of medication side effects, especially when it comes to something as essential as our oral health.
Wow, so we're talking about medications, we're talking about access issues, all these things playing into this complex connection between oral health and disabilities.
Definitely complex.
And in what you send over, some conditions really stood out as like prime examples where this link is just impossible to ignore,
Right.
like spinal cord injuries. Talk about a life-changing event that comes with a whole new set of challenges every single day.
Exactly. Think about it. When you're dealing with paralysis, maybe even severe paralysis, suddenly something as basic as brushing your teeth,
Which most people don't even think twice about.
right? They don't. It becomes so much harder. Flossing, even just moving food around in your mouth, it's all impacted. And for a lot of people, it means relying on others for help, which brings its own complications.
Oh, for sure. Not to mention the medication side effects we were talking about earlier.
Exactly. Adding another layer to the whole thing.
And it's not just spinal cord injuries. You mentioned cerebral palsy in your research, and it's a great example of how these challenges can be so multi-layered.
It really is.
Reading through that, it hit me. It's not just one single oral health risk with CP. It's like this whole cascade of potential issues.
Totally. Cerebral palsy affects muscles, right? How they move, how coordinated they are, and this can show up in a bunch of ways that directly affect oral health.
Like what? Give me some examples.
Well, you see delayed tooth eruption, high risk of gum disease, more cavities, even breathing issues can crop up.
Breathing issues.
Yeah, difficulty breathing through the nose, which can actually lead to more cavities because of mouth breathing.
See, that's something I never would have connected. Mouth breathing and cavities. It's like this domino effect.
Exactly. Plus, people with CP often have other things going on too. Acid reflux, teeth grinding, all of which needs specific dental care.
Makes you realize how important early intervention is and ongoing specialized care.
Huge. And when it comes to physical challenges and oral health, muscular dystrophy is another one that really hits home.
Yeah, that one really got to me.
This is a group of diseases that basically make your muscles weaker over time. Imagine even just brushing your own teeth, something most of us do without thinking,
Exactly. I was struck by that. We take it for granted.
can become incredibly difficult, even impossible. for someone with MD.
It really emphasizes how important caregiver support is in these situations.
It goes beyond just preventing cavities, too, though that's obviously important. It's about dignity, quality of life, being able to eat comfortably, enjoy a meal. It's all connected.
That connection between our physical health and just feeling good overall.
Exactly. And while each of these conditions has its own challenges, there are common threads, right? Like cystic fibrosis, that's another one we should touch on.
That one stood out to me because it's not necessarily what you think of when you hear physical disability.
That's a great point. We love to categorize things, but the reality is CF, while it mainly affects the respiratory system, the lungs and all that, and the digestive system, it can absolutely lead to physical limitations.
Right. It's not just the initial diagnosis, it's how that condition changes things over time.
100%. Over time, someone with CF might have problems with their lungs, their overall health, which can lead to trouble moving around, other challenges that affect oral health. Plus, they often take a bunch of meds, which takes us back to dry mouth and all that fun stuff.
It's like this web, and it just highlights how crucial it is to look at the whole picture when we talk about healthcare, not just treating symptoms in isolation.
Couldn't agree more. And let's not forget about amputations, back injuries, MS.
That's right.
Which can cause fatigue, muscle weakness. It all comes back to access to care and making sure that care is individualized.
And being aware of the barriers people face, whether it's a physical limitation or they can't afford it, or even just doctors who don't get it.
It all adds up. There's so much standing in the way of people getting the dental care they need.
It really makes you think about all the things we take for granted. It's kind of daunting when you realize how big these barriers are and how something as important as taking care of your teeth can be affected by so many things.
Yeah.
But the good news is it's not all doom and gloom, right?
Right. There are definitely solutions out there.
People working to change things.
Absolutely.
And the research you shared had some really practical tips on making oral health more accessible for people with disabilities. So what can we do? Where do we even start?
Well, I think it starts with a shift in how we think about dental care. It shouldn't be a privilege. It should be a right.
100%.
We need a healthcare system that includes everyone, no matter their physical abilities.
So what does that look like? How do we actually make dental care more accessible?
It's about thinking through the whole experience, every step, and considering what someone with a disability might need. Offices need to be wheelchair-friendly, ramps, wide doorways, chairs that adjust things like that,
Makes sense.
and then transportation.
Right, because not everyone can drive themselves.
Exactly. And what about the equipment dentists use? Can they accommodate different needs, like lifts to get someone from their wheelchair to the dental chair?
Which, when you're used to just walking in and sitting down, you don't even think about it. But
But those little things make all the difference. It's about making people feel welcome, not like they're a burden or an afterthought. It's great when dentists have good intentions, but if they haven't adapted their practice to actually serve people with disabilities, it's not enough. We need real change.
system-wide change.
Exactly.
So what about people listening, individuals and caregivers who are dealing with these challenges every day? Any tips on at-home care that stuck out to you?
Oh yeah, tons. Like simple adaptations can make a huge difference. Adaptive hand grips for toothbrushes, for example.
Oh, for people who have trouble gripping.
Yeah. Imagine trying to write with a pen that's too small for your hand. You can do it, but
It's awkward, difficult.
exactly. And sometimes an electric toothbrush can be a game changer. Less movement, less strength needed.
Right, because even those tiny movements can be tough depending on your situation.
Exactly. It's all about finding what works for each person.
And communicating, talking to your dentist, your hygienist about what you're dealing with.
100%. They can offer advice, suggest different techniques, come up with a care plan that works for you.
It's so important to remember there's no shame in getting help, in asking for what you need. And the good news is there are answers out there. We've covered a lot today. Statistics, challenges, and most importantly, the fact that we can make things better. What are you hoping people take away from this conversation?
I think the biggest thing is realizing how widespread this is. 1 in 4 adults in the U.S. with a disability, that's huge. Their needs matter. And we have to remember that disability is not one size fits all. We can't make assumptions about what people need based on what we see. It's about listening, being open, creating a space where people feel safe to speak up for themselves. And finally, I hope people walk away feeling hopeful. Because there are solutions. On a personal level, on a bigger level. By raising awareness, advocating for change, supporting inclusive healthcare, we can make a real difference in people's lives.
It's about recognizing that this isn't someone else's problem, it's on all of us. We all have a role to play.
Well, thanks for diving into this with me. Always learn so much from these conversations. And to everyone listening, keep those smiles bright and remember everyone deserves good oral health.